Hi, I'm Desiree Chappell. Welcome to Top Med Talk. It's Tuesday and it's time for my Roundtable. The Roundtable is a chance to sit down with a multidisciplinary group to have discussion about perioperative care and improving the quality of what we do every day.
Top Med Talk.
I'm Desiree Chappell, lead anchor for Top Med Talk, and I'm delighted to be sitting down today, and actually it's lunchtime, so hoping to get some food in a second. It's been a busy meeting. But excited to be sitting down with a very special guest from Saudi Arabia. I am going to let Fatimah introduce herself in just a moment. But we also have our two Perioperative Medicine Fellows from UCL. So do you guys care to introduce yourselves?
So my name's Douglas Blackwood. As you say, I'm a Perioperative Medicine Fellow over in London at UCH. And we're here enjoying the day, enjoying the weekend.
Good.
And I'm Nicole Greenshields. I'm also a Perioperative Medicine Fellow at UCLH, and we're both anaesthetists there as well.
Right, fantastic. Thank you guys so much for joining us. I hope you've enjoyed the meeting. And
it's been great so far.
Good. Well, our special guest is actually a delegate here at the EPOM USA 2018 meeting. And we have Fatimah Alsalah. Is that correct?
Alsalah.
Yeah. Close. She's from Saudi Arabia. She's a transplant anesthesiologist at the King Fahad Specialist Hospital. So, Fatimah, thank you so much for sitting down with us. We've been chatting a little bit over the weekend.
My pleasure.
And learning more about what you've been doing. So, I just kind of want to dive straight in. Tell us why you're over in the States right now.
So, I'm here in Eisenhower Fellowship, and it's a program which is extended for 4 weeks. And the Eisenhower Fellowships is mainly focusing on mid-career people with inspiring projects, and they help them to, achieve their goals by exposing them to people who had the same experience before, right? So I'm here in the state for 4 weeks, exploring ERAS programs everywhere, all over the states. I've visited most of the medical centers, the east, west, and the middle.
Wow.
And I'm very lucky to have the EBOM falls within the third weekend I'm here in the States.
Yeah, well, serendipitous that you could come and join us. That's great.
Yes.
How did you hear about EPOM?
I found it online while I'm searching about evidence-based ERAS programs. Mm-hmm.
Oh, that's fantastic. Mm-hmm. So you said it's people working on projects. So what is the project that you were working on at your facility?
I'm working on enhanced recovery after surgery project in my facility, and I was about to start. My go-on time was 1st of September, and then I was granted this fellowship, and then my vision was inspired and got wider, and then I just stopped and stepped back, and I thought I'll just see how everyone over the world are doing it, and then get it right from the beginning, because it's not very clever to repeat the same mistakes, I guess.
Yeah, one of the good things is you learn from others.
So my vision now is to start the enhanced recovery program within my facility and then extend it to the whole eastern region clusters, which is like 7 to 8 hospitals, and then I have a goal to bring it to nationwide.
Oh, that's fantastic.
All hospitals in Saudi Arabia.
So do you have partners that you're working with in your facility? I mean, how is buy-in going for you? That's a big topic of this
Yes, of course, yes. So I have some support. My chairman is number one, of course, and then a few members from the anesthesia department. I have new colleagues who are just joining as staffs recently who are very inspired and they want to get this going.
That's good. Well, Nicole, did you have a question?
Well, I just don't know much about anesthesia in Saudi Arabia. Are any other hospitals doing any enhanced recovery or aware of it? Or
some hospitals are aware. 2 hospitals which are independent of the Ministry of Health, they just started within the last year.
Oh, fantastic. So people are aware of the need for it, and kind of hopefully will be kind of early adopters and encourage.
And how did you get... Oh, sorry.
No, go on.
I was just going to ask, how did you get interested? What was it that, you were walking around one day and thought, I want to implement an ERAS program?
That's a good question. So ERAS program was starting in Ontario during my fellowship in transplant. So I was actually ERASing patients in there. And when I went back home, I wanted to start the ERAS program 3 years ago. Unfortunately, the media and the culture in the hospital was not yet ready for that. So I've been talking about ERAS for the last 3 years, but now it's going.
And what surgeries are you hoping to start with? How are you?
We're starting with the gynae oncology patients. Our surgeons are very supportive. Some colon surgery patients as well, they're starting, but I think that will be the next step.
And with regards to kind of, I guess, the practicalities of it and getting the carbohydrate loading drinks and things like that, are they available over there, or have you had challenges trying to get hold of them?
I do have challenges because that's the only thing I'll need funding for, right? Yeah. But everything else is actually available.
Fantastic.
I have to plead a bit of ignorance when it comes to the Saudi Arabian sort of medical system, I guess. But I mean, what do you think? Do you think there's any particular barriers that you're going to find there that perhaps are different than say in the UK or the US or Canada where you've worked before?
Yeah, so I thought at the beginning when I started to talk about ERAS, I thought that I'm the only one who's facing the cultural resistance and people who do want to change their practice and the financial or support around it. But after 3 weeks and everywhere, I guess it's the same problem all over the world, right? Yeah.
Universal barriers, challenges, and successes too. I mean, the benefits of what we're doing. So how have you been working with the surgical colleagues, your nursing colleagues, to really bring this about in your institution?
So I start with talking to everyone, and then some people are interested in it, and then we started to, do minimal mini meetings. We're just chatting about it, and we have a draft of the protocol. Of course, everything will be modified after the Eisenhower Fellowship, right?
Go back to the drawing board.
Yeah, and I figured out that I'll need more involvement and a bigger team at the beginning. So now I'm going to add to have a pharmacist within the team, a physiotherapist within the team, quality member. I've already asked for a job line for a nurse practitioner to put things together, like a coordinator kind of thing, yes. Mm-hmm.
Oh, that's fantastic. I hope you get that. It makes a big difference.
Me too.
You can do it without, but it does make a difference.
Yes,
I think we've struggled in kind of like the UK and the hospital we work in. We're trying to implement a thoracic enhanced recovery program, and actually the physiotherapists have been the ones that have been fantastic and had more motivation than anyone else in the team, and it's been really great having them on board. But I think having a nurse practitioner is really beneficial, because for us the biggest problem is we're not on an electronic health record. So trying to collect the data to see the compliance, and without seeing how well you're doing and whether you're changing outcomes, it's difficult to get more people to then buy into things.
Yes.
So I think he or she will be invaluable to your kind of plight for...
Of course. Yeah.
And just that constant driver as well, someone who's there doing it day in, day out, because for the best will in the world, you still have a job, you still have to give anaesthetics, and you just can't be there all the time. So if you have someone who's always there on the ward encouraging things, then I think it just makes it work a lot better.
One more thing, I think if the patient sees the coordinator at the clinic and then at the day of surgery and then the post-op, it's the same face which the patient sees every day, that kind of
continuity of care.
That's more motivation for the patient's involvement,
Definitely,
right?
Definitely. Yeah. And is there anything that you've picked up from the last 2 days? Because we've obviously talked quite a lot about ERAS at ETBOM. Is there anything in particular that you've thought, yes, that's going to work well, or not, I guess?
Well, I heard a lot of my voice and ERAS speakers, and that's the most thing I loved in the EBOM meeting, because a lot of people are talking in the same way. They're talking my voice. Right?
It is. I always tell people whenever I like the session yesterday afternoon, I said that could be that's my presentation. I mean, that's what I say every time.
Yes.
And what I love about what EBPOM is doing and what we're trying to do here on Top Med Talk is share that voice, and that we all are. I always say it's like we're commiserating, really, because I mean it's a struggle, but again we can celebrate our successes as well, and that's what I love about it. But yes, it is very lots of common themes and statements and things like that.
Exactly.
I did have one question about data. So how is that working in your facility? Do you guys have an EMR? Is that within the healthcare system in Saudi Arabia?
Yeah.
How does that work with what you're doing?
So data collection is one of my biggest struggles, and within the hospital, we do have an electronic medical record for the patients. That's why I'm involving one of the IT and my team from the beginning, so they can help me accomplish this within the hospital. But it's going to be much more challenging when I try to spread across the cluster, the Eastern Region cluster, and then across the country. I still need to figure this out.
Yeah. Is data shared easily within your country? I mean, between hospital facilities?
There is a plan for that, but it's not yet there.
Yeah, gotcha.
That sounds like every other country in the
It
world.
does,
I guess so,
absolutely.
yes.
It's so everyone's kind of just isolated in their own microcosms, and it really makes it difficult to get out there and share. I mean, even though we have CMS and you have the NHS, you think it'd be easier. Yeah. But
no.
How is it going when you are collaborating with these other facilities, or have you done that yet? Reach out to the other facilities that are doing ERAS.
So I'm trying to, prove it to work in our own facility first before I spread.
Yeah.
So I've got a timeline for that. We're supposed to start in 3 months after I put everything together again after I go back home, right? And my plan is to spread within the hospital within 1 year, and then 1 year from now I'm planning to spread across the cluster.
Yeah. What about the facilities that are doing enhanced recovery right now? Have you been talking to them?
I did. John Hopkins and Bahrain, they're affiliated with John Hopkins Baltimore, so they're John Hopkins Hospital. They're the one who started with colorectal within the last year, and they're having very positive results. They're starting with colorectal so far.
Yeah, that's great. Maybe you guys can put together kind of even a regional workshops and things like that might help with the education.
Yeah, so the plan is to bring EBOM to Saudi Arabia next.
Yeah, I love it.
That sounds great.
So it's available for everyone in the cluster to have all this science and ambition before they start in their own facilities, right?
Well, EBPOM Saudi Arabia, it's coming.
The great thing is everybody at home can listen to everything, and kind of if you get people on board and get kind of a program going, then at least they've got access now with the internet and podcasts and everything.
And so we can work on translation, or you can meet maybe one of our contributing editors from Saudi Arabia. And
wonderful.
In your native language, and then you can help disseminate information there.
Of course.
So we'll give you a platform for that.
Yeah, perfect. Thank you.
Well, Fatimah, thank you so much for sitting down. This has been an enlightening conversation. I really appreciate it. And to you guys, the fellows at UCL, and I'm excited that we may have a future over in Saudi Arabia. I can't wait to work with you.
Yeah, thank you very much. Me too.
Well, safe travels. I hope you enjoy the rest of your time here in the U.S.
Thank you.
All right. Well, thank you so much for listening to Top Med Talk here at EBPOM USA 2018. Be sure to follow us. Gosh, I can't talk. I've been talking too much here at the meeting this time. Please follow us on Twitter, Facebook, LinkedIn, YouTube, as well as subscribe to Top Med Talk on your favorite podcatcher. And also be sure to sign up for our email newsletter. We're definitely going to be upping the game on that and putting out new information, top 10 podcasts, and special guests. So be sure to follow. Thanks.
Top Med Talk.
Lee Majerison here. Thanks for listening to Top Med Talk. Now, before we let you go, it's important that we remind you to subscribe to Top Med Talk. That way you'll never, ever miss another episode. Also, if we could encourage you to join us on social media, Twitter, Facebook, LinkedIn, YouTube, pretty much every single social media platform, we're there. Join us. And finally, check out topmedtalk.com. If you go to our website, you can subscribe to email updates. That way we can always tell you where we're going to be, what we're going to be doing, and how you can join us. topmedtalk.com, and click on the section marked email updates. Finally, Top Med Talk is proud to act as the broadcasting arm of EBPOM, Evidence-Based Perioperative Medicine. We'd love you to find out more about them as well. ebpom.org is their website. That's ebpom.org. And if you go to ebpom.org/meetings, you can find out about some of the wonderful meetings that we attend and cover across the year here on Top Med Talk. That's ebpom.org/meetings.